Hey everyone, welcome back. And if you're new, my name is Piper. 4 years ago, I had anterior cervical discectomy with fusion surgery, also known as ACDF. And today I'm going to be talking about what led to my surgery as well as what my recovery was like. About 10 years prior to me having to have my surgery, I was in a pretty serious car accident where I was rear ended. And I believe that that is ultimately what led to me having to have this surgery. Immediately after my surgery, I sought chiropractic care because it just so happens that I was already seeing a chiropractor regularly. And she got me in the day after the accident. And I was able to kind of manage the whiplash and the, neck discomfort that I was having due to the accident. But over time, I would say probably about 5 years prior to surgery, I really noticed that my neck was sore a lot. I'd have like neck pain. I'd wake up in the morning with like tightness and actual pain, where eventually I was waking up with headaches almost every day. And it was really affecting my life because I would wake up so grumpy from being in pain, and it was not a fun way to live. So, when these symptoms started showing up about 5 years prior to my surgery, I decided that I should go see a doctor. So, I consulted with a couple neurosurgeons over that time frame, did my MRIs, met with them, and what they told me was is that I had degenerative disc disease as well as spinal stenosis, but that it wasn't so severe at that time that I would require any surgery, but that eventually more than likely I would have to have this surgery done. But, I wasn't in any hurry to have the surgery. So in the meantime, I did a lot of physical therapy. I saw a lot of chiropractors. Um, I even at one time was seeing an osteopathic doctor quite regularly. And an osteopathic doctor is like a chiropractor, but with a medical degree. So he's able to write prescriptions for, medications or anti-inflammatory medications. And so I did get a prescription for an anti inflammatory, which helped me on the days when the pain was so bad um, that it was hard to deal with. But I really tried to minimally use that. I don't even like to take Advil regularly, but that helped me when I really needed it. So, a few months before I had my surgery, I decided to go see a doctor who had done my husband's back surgery the year before, another neurosurgeon. And I went and, had another MRI. And when I went in to meet with him, I was surprised to learn that my spinal stenosis was now so severe that even a fender bender could cause serious damage or paralysis, as well as the fact that my spine and my neck was starting to curve in the opposite direction. And obviously, I still had the degenerative disc disease as well as multiple bone spurs in my neck. And I was told that I would need surgery pretty quickly. I didn't have a lot of time to really think about whether or not I should do the surgery because I guess in my mind, I already knew that eventually I would need it. So I just scheduled it, and a few months later, I had my surgery. I want to talk about recovery a little bit because there was a few things during my recovery that really surprised me. And the first thing is the emotional impact that this surgery had on me. After my surgery, I was overcome with depression for quite a while, and I'm not sure if it was just the shock of having such a serious operation and thinking to myself, what have I done? I've altered, my body in this way that will never go back to the way it was. I don't know. I mean, I think that was part of it. Um, but I was surprised that I felt that way. I had undergone quite a few surgeries over the course of my lifetime, and I never experienced feeling depressed like I did with this surgery. And I think it ties into the other thing that surprised me, which was how long it took for me to recover. When I say recover, I don't just mean pain wise, I mean feeling back to being myself. At the time of my surgery, I was still teaching, but I was teaching remotely due to COVID. So I went back to work about a week after my surgery, which looking back now, I probably should have taken a little more time off, but I thought it'll be fine. I'm at home. It'll be doable. But I was very tired during the day. And my voice definitely was not normal for several weeks after. Your voice is very scratchy and you sound very hoarse. I'd say some of the biggest challenges in recovery was just the pain. I mean, obviously you have pain after you have any kind of surgery, right, or medical procedure, but it's not the pain from where the plate and the screws are in your neck. It's your throat mostly, because what happens is a day or two after your surgery, your throat begins to swell up, and it's very hard to swallow, and it's extremely hard to eat, and it's painful. It's probably the worst sore throat I've ever had in my life. And another challenge is building back the strength in my shoulders and my upper body. That's definitely still a work in progress. I think for so many years, the muscles in my neck were so tight from, compensating for the pain, that once you have this surgery done and those muscles kind of get stretched out a little bit, they flare up and it's painful. At one point, I had some shots in my shoulders and the back of my neck to try to get my muscles to relax some more. I mean, and that definitely helped me. Another challenge that I still have today is sleeping. And by that, I mean finding a pillow that supports my neck, because there are days when I still wake up with stiff necks. Some things that helped me during recovery was the obvious one is physical therapy. So when you undergo this type of surgery, there is going to be physical therapy after. It doesn't happen immediately after, but making sure that you go through that and complete it is really important. It helps with pain and just getting your mobility back. Another thing I did when I was doing physical therapy is I would have dry needling done on my shoulders to try to help with the pain I was having there. Another thing that my doctor had me do, which I'm not sure if all doctors do this, but I used a bone growth stimulator. And it's not painful or anything. It's just a device that you put at the back of your neck, and you do it for, I think, a couple of months for like 30 minutes a day. And what that does is it helps your bones fuse quicker and stronger and really promotes healing quickly. I would say another thing that has helped me post surgery is just making sure that I'm moving my body every day. I've always been an active person, and so that really hasn't changed for me since surgery. My workouts might look a little different though. I definitely can't lift heavy weight. I don't want to put the strain on my neck, but I do work out 5 to 6 days a week. And I do, various workouts. In addition to that, I do massages once a month. I've even tried acupuncture too, which I think helped. Um, I just didn't do very many sessions of it. Another really important thing that I do is follow an anti inflammatory diet. As a woman in her 50s who's going through menopause, this is also extremely important to help me deal with those symptoms that come along with that, but that's a whole other video. Some of the things I would do differently after surgery is probably the biggest one is just to be patient with myself. I tend to be an impatient person. And like I said earlier, I thought I was going to be back to myself in a few weeks. And when I wasn't, it really affected me. So I think, you got to give yourself some grace and definitely give yourself time to heal. And I think the other thing is accept help. If you have people that are willing to help you, then take it. I was lucky. I had a great support system with my husband and my children. So Don't be afraid to ask for help either. So that leads me into advice I would give someone that was facing this surgery. And I think first and foremost, it would be to set realistic goals for yourself. That kind of goes back to the being patient and the accepting help. Don't think that you have to do everything by yourself. I definitely was cooking and doing light housework way too soon. And you'll know because your body will tell you that, you're doing too much. I think another piece of advice is to start moving your body when you can. As soon as you're cleared to start walking, do it. It not only helps you physically, but it helps mentally as well. And lastly, just stay positive. I know it's hard. This is a scary, serious surgery, but focus on the positive things that this is going to help improve the quality of your life. So if you've had this surgery or you're preparing for it, I'd love to hear from you. Drop a comment below. Thank you so much for watching this video. If you found this information helpful, please like, subscribe, and share this video so that more people can get this information. I look forward to seeing you in the next video.